Hi, my name is Veronica and my dream job is to be a clinical pharmacist who specializes in infectious diseases for the Department of Veteran Affairs. For as long as I can remember, I've always wanted to be in healthcare, and I've always had an interest in helping those who suffer from lifelong illnesses and diseases. And I've always wanted to work with the VA because I find it as a way to give back to those who have served for our country. So this position basically embodies all of that. It requires you to be a licensed pharmacist who's knowledgeable in infectious diseases, especially HIV and hepatitis C. And according to the job description that's on usajobs.gov, this position is responsible for providing comprehensive infectious disease medication management services. So this includes monitoring patient drug therapy through consultations and clinical visits, being a resource of information for your staff, and also being a part of an interprofessional team which includes other pharmacists and physicians. So in order to be successful in this position, I believe the most important skill to have is to be an effective communicator. This includes being an active listener and being able to communicate effectively verbally and non-verbally. So as an active listener, you must be mindful. You must be able to focus on what's happening in the moment and focusing on the person you're interacting with. For verbal communication, it's important to be able to provide clear and concise instructions, whether it's directing a person or their caregiver on how to administer medication or relaying basic information to your colleagues. As we know, verbal communication involves a lot of steps, but the most important ones related to this role include responsiveness, because we want to be able to ask questions. We want to be able to provide statements of agreement or disagreement so that patients or colleagues know that we are being attentive to their thoughts and feelings. Another important thing is person-centered communication. This allows us to adapt to specific individuals. For example, if I'm talking to a work colleague, I know I can use medical terminology because they'll understand it. However, if I'm talking to a patient, I would have to use more simple terms because I want to make sure that they're understanding the point I'm trying to get across. Another important role as a pharmacist, you want to create a communication climate. So you want to offer recognition. You want people to know and feel that they are seen. You also want to be able to acknowledge and endorse people because this allows them to know that we're being attentive and accepting of their feelings. And this is crucial in a place where people are fighting with infectious diseases. Lastly, nonverbal communication. This is important because this involves responsiveness, which is eye contact, facial expression, body position, and kinesics. So body posture and motion. This is important because this shows the patients or colleagues how interested we are and how confident we are in our abilities and our knowledge, which helps build trust for us from them. So based on these skills, I feel like I'm the strongest in the concept of listening and responding to others. I feel like this is a valuable asset that I can bring to the Department of Veteran Affairs if I'm hired for this position. In being a good listener, I am mindful in the sense that I can focus on someone despite of what's going on around me. I'm able to interpret communication. I'm able to recognize other people's viewpoints whether I disagree or agree with them. This gives me the ability to come into the conversation without being judgmental and have a better understanding of them. I'm also able to be responsive. I ask questions so I can build a better rapport and create a better environment to work for my colleagues and a better environment for patients to receive treatment. I also like to remember. I paraphrase statements made by patients and colleagues because this helps me remember key points that they want to make, as well as check for understanding. If you look at my resume, you can see that I've worked in a pharmacy setting for over 8 years, and I've worked in a retail setting for over 11 years. This helped me develop my listening skills, which are essential in this field, and I feel like it'll be a great contributor to this agency. Along with being a good listener, there are some skills that I need to improve on. So over the next several weeks, I plan to make more phone calls, FaceTime with friends and family, and answer those calls I like to avoid. I'm usually a texter, so I feel like by doing so, I'm able to be more confident and step out of my zone and build better communication relationships. And I also feel like I need to work on my facial expressions. I feel like I express my thoughts and feelings through facial expressions, and it's not always a good thing. So by being able to communicate a lot more with people over FaceTime or in-person interactions, I can have people make me conscious of those times where I do make facial expressions or avoid eye contact, so I can help better those skills. And once I perfect those skills, I know I'll definitely be a much better candidate for my dream job.